Hello, I'm Dr. Alan Jacobs, board-certified rheumatologist at the Arthritis Center of Nebraska. One of my personal interests is the prevention and treatment of osteoporosis, a debilitating bone disease that affects as many as 10 million Americans. Thank you for joining me as we discuss osteoporosis, building your bone health. Osteoporosis literally means porous or sponge-like bones that break easily as one ages. It is not the same as osteoarthritis, which is a joint disease that leads to joint pain. Osteoporosis does not cause pain until a bone breaks. There are two reasons why osteoporotic bones break. The first is that there is not enough calcium in the bone to make it strong, so the bones are too thin. The second reason is mechanical weakness in the structural arrangement of the calcium. This is much like when an old bridge collapses. This is called brittle bone. This worsens with age, and that is why most osteoporotic fractures occur after age 65. The effects of osteoporosis include serious fractures, especially of the hip and spine. Many people die of the complications of a hip fracture or end up totally disabled in nursing homes, needing wheelchairs and walkers to get around. Multiple spine fractures collapse the spine and cause serious deformity. These changes cause permanent spine and rib pain. The problem with osteoporosis is that it is a silent disease. Calcium from the skeleton can be lost slowly over 20 years, leading to a gradual loss of height and a spinal deformity called the Dowager's hump. The amount of calcium in the skeleton depends on a lot of genetic factors in the family and how fast calcium is lost from the skeleton, especially at the time of menopause for a woman. Men have more calcium in their bones than women. To find out if early osteoporosis is present, please consider getting a bone mineral density test, which is also called a BMD. The most useful BMD test involves measuring the density or the amount of calcium in the lower spine and hip. The BMD test takes only 10 minutes and is painless with minimal X-ray exposure. Your bone calcium level is compared to younger people and also to people your age. When a comparison is made to young healthy bone, the result is called a T-score. The T-scores that are below -2.5 are in the osteoporosis zone. Your bone density can be followed, and a computer can graph the results over a very long period of time. The bone mineral density test is not the only important osteoporosis test. By evaluating a few key risk factors, a calculation can determine the likelihood of getting a fracture in the next 10 years. This can really help decide when to start osteoporosis treatment. Another very important test is to look for fractures in the spine with X-rays. Many people are surprised to find out that they had a fracture and did not know about it. These fractures increase the risk of getting more fractures. Many bone density machines can detect spine fractures and add a computer analysis. Repeat fracture tests can be very useful to judge if osteoporosis treatments are actually working. There are key risk factors that predict who may get an osteoporotic fracture. These include increasing age, female gender, white race, family history, especially for a hip fracture in a parent, diseases like rheumatoid arthritis and Crohn's disease, medications like prednisone and seizure medications, smoking, excessive alcohol, and frequent falling. Because there are diseases that cause osteoporosis, it is important to have testing that will look for them. Not every low bone density test will be from osteoporosis. It is important to check the bone vitamin or vitamin D level. Experts want the vitamin D level above a certain level for the best bone health. Certain lab tests should be done before starting our osteoporosis treatments. This includes the blood calcium level and kidney function test. You can do a lot to help yourself to limit osteoporosis. Stop smoking, limit the use of alcohol, exercise regularly, and use the amount of calcium and vitamin D supplements as suggested by your healthcare provider. For those with a high risk of getting an osteoporotic fracture, prescription treatment should be used. There are many options like Fosamax, Actonel, Boniva, Evista, Reclast, Miacalcin, and Forteo. Ask your healthcare provider which one is best for you. These medications over time will reduce the number of fractures by 50%. Successful osteoporosis treatment is considered to be a major medical breakthrough and one of the most significant advances in the last 15 years. If you unfortunately have a spine fracture that causes severe pain, there is hope. Doctors may be able to relieve the pain in 24 hours by injecting cement into the fractured spine. This procedure is called an injection vertebroplasty and is now widely available. If you have osteoporosis and are on treatment, keep an eye on your calendar to consider repeating the bone density test. In general, the optimal interval is about every 2 years. Bone mineral density changes very slowly, and it takes a long time to measure a significant change. Repeating key laboratory studies over time is also a very good idea. Thank you for your interest in learning more about the prevention and treatment of osteoporosis. We hope we can be of service to you at the Arthritis Center of Nebraska. Please call 402-420-1212 for more information or to schedule an appointment.